immediate joint surgery without any upfront costs.
Lisa Borsey's first hip replacement left her $7,000 out of pocket. So when the familiar agony started in the other hip, she thought she'd be waiting and saving for months. Thankfully, her surgeon had a no-gap option.
I was just so happy that I could just do it and I didn't have to worry about it.
Lisa is one of more than 1,000 patients across New South Wales and Victoria who've benefited from a new agreement between Medibank and Healthycare to provide no-gap services for hip and knee replacements and endoscopies.
And what we've been able to do is save on average $1,500 in out-of-pocket costs, which is a big deal for families and will mean a number of individuals would get surgeries that otherwise would have delayed.
Medibank and other funds like NIB and HCF have offered no-gap surgeries at select locations. But this deal almost doubles the number of hospitals offering the no-gap option to include Hurstville Private, Tuggerah Lakes Private, Lingard in Newcastle and, crucially, a number of regional private hospitals like Dubbo and Maitland.
The key priority here is that patients get access to the care they need as soon as they can.
Of course, these surgeries are free in the public health system, but the delay can be torturous. Most patients are waiting between 8 to 12 months for a hip or knee replacement in a public hospital. Many wait even longer. The latest figures show 24% of hip replacement patients and 37% of people needing a knee replacement in New South Wales wait more than a year. Saving time and money, both crucial to the ultimate outcome.
So the more we can alleviate all other concerns, the better the patients will do and the more they'll focus on their recovery.
I feel like a new person, new parts.
Jane Azzopardi, 9 News.